My mental health journey started in 2011, where I started in the field of disaster and emergency management and was responsible for helping disaster survivors recovering their homes, their businesses, their agricultural operations, even not-for-profits. And that's where I developed acute stress disorder. What triggered it was really the work of the last 3 years working with these groups and kind of facing the workload and work pace of that. I had no ability to manage my emotions. Anything could set me off due to the irritability. And there was no way that I could forecast what would set me off. We would go on vacation and I'd start to see like clouds rolling in when we're at the lake, and I'd start to get super anxious around the weather turning. I was having a hard time with relationships at work. Again, the frustration and irritability and the stress was just causing me to come off as short-tempered. Coming home, being really irritated at home, not wanting to go out, not wanting to engage with my wife and my kids. All of those things combined, it was very distracting. After some continued support from my wife and some nudging to get some help, I finally went in and dropped into a medical clinic one day and had a blood pressure test and saw that it was hitting like 170 over 110. So at that point in time, and after talking to my doctor, he just said, based on my current situation, he gave me 30 days off work. So that right there started my recovery. The 30 days allowed me to come down off the acute stress and get the support that I needed to get stronger. I used to be a search and rescue volunteer, and we were always taught that the hardest thing for someone who's lost is to admit that they're lost. So I have this thing for myself I call, is it a sign? Is it a sign that there's an event or something coming up that might trigger stress in me or cause me to go back into a hole of depression? So I watch for those signs, and what I've done is I've set up a structure, something else I preset my support. Who do you look for? Where do you go? Who's a good psychologist? What kind of psychologist do I need? If you can get to the point where you can meet with a few, find one that you click with, spend an hour, a session or two with them, giving them your background and your history, then it's a simple phone call or email for that first session. They've got some background on you and you can get into the situation well prepared. The first big step and the hardest part is admitting that you have a mental health issue or a mental illness or that you need help. If you can overcome that and admit that you need help, and you can take a few quick steps to find and get that support either through a crisis line or your benefits at work or an employee assistance family program. Use that tool as fast as possible, have the number on hand, and move into that support group. My advice to managers and leaders within the Working Stronger program would be to support your staff if they're feeling supported and the manager understands the support they need and why they need it, especially around depression, other things like that. If someone is going through that in their life, it's going to impact their work. So if you can make it better for them at work, theory says their life should get a little bit better, and that will increase their happiness and motivation and engagement. As managers, as leaders, we are strong if we can provide that support. As employees, we are strong if we can receive the support that we need.